Welcome to the Hizentra infusion video with prefilled syringes. Self-administration with a pump made easy, so you can get back to living your life your way. This video will walk you through the process for pump administration with Hizentra prefilled syringes. It is not a substitute for training by a healthcare professional, and it does not include specifics about dosing or treatment schedule. Once you have learned how to self-infuse Hizentra from a healthcare provider, you and your doctor can decide on an infusion schedule that works best for you. Meet Melaine, an active mother of 2 grown sons who teaches yoga and cycling classes. Melaine learned how to self-infuse Hizentra from a healthcare provider and worked with her doctor to create a customized infusion routine, and so can you. Follow these simple instructions each time you give yourself Hizentra, and always perform the steps in order. With Hizentra prefilled syringes, self-administration is as simple as ready, set, go. We'll take you through the infusion process step by step. First, you'll need to get everything ready. Step 1. Gather your supplies. You'll need Hizentra prefilled syringes, an infusion pump, infusion tubing, and needle set. Please check the prescribing information for the full list of supplies. Step 2. Clean the table or other flat surface where you will be preparing your infusion. Step 3. Thoroughly wash and dry your hands. Let's get set for the infusion. Step 4. Check the prefilled syringes. Carefully peel back the transparent covering from the tray and inspect the protective cap. Then, peel back the outer layer of the wraparound label on the syringe so you can see the liquid. But don't remove the label completely. Carefully inspect each prefilled syringe. Hizentra is a pale yellow to light brown solution. Do not use the syringe if the liquid looks cloudy, contains particles, or has changed color. If the protective cap is missing or defective, or if the expiration date on the label has passed. Step 5. Prepare Hizentra for infusion. Hizentra is the only immunoglobulin that is available in vials and prefilled syringes. The prefilled syringes eliminate the need for vial transfer, which may reduce steps and effort compared with vials. The 5 and 10 milliliter prefilled syringes are fully assembled. For the 20 and 50 milliliter prefilled syringes, screw the plunger rod onto the prefilled syringe stopper prior to use. If the Hizentra prefilled syringe does not match the infusion pump requirements, transfer the contents of the prefilled syringe to a syringe that is the size required by your infusion pump, using a syringe-to-syringe transfer device. Remove the protective cap from the prefilled syringe. Twist transfer device onto the prefilled syringe. Then screw the empty syringe onto the other side of the transfer device. Push the plunger of the prefilled syringe to transfer Hizentra into the empty syringe. Repeat this step for as many prefilled syringes as you need to achieve prescribed dose. When the transfer is complete, unscrew the empty prefilled syringe and transfer device from the larger syringe specific to your pump. Step 6. Prepare infusion pump and tubing. Connect the syringe filled with Hizentra to the infusion tubing. Prime the tubing by gently pushing on the syringe plunger. The tubing will fill with Hizentra. Stop priming before Hizentra reaches the needle. Insert syringe filled with Hizentra into the infusion pump. Now, you're all set for step 7. Prepare the infusion sites. Select an area on your abdomen, thigh, upper arm, or the side of your upper leg or hip. The number and location of infusion sites depends on the volume of your total dose. Change the actual site of infusion with each administration. Up to 8 infusion sites can be used at the same time with pump administration. If you are using more than one infusion site, be sure the infusion sites are at least 2 inches apart. Hizentra is infused subcutaneously into the fatty layer located just under the skin, and never into a blood vessel. Do not inject into a vein. Do not infuse Hizentra into tender, bruised, red, or hard skin. Avoid infusing into scars or stretch marks. Once you have chosen sites, clean the skin at each site with an antiseptic skin prep and allow skin to dry before proceeding. Step 8. Insert the needle. With 2 fingers, pinch together the skin around the infusion site. Use a quick, dart-like motion to insert the needle straight into the skin. Use sterile gauze and tape or transparent dressing over the infusion site to hold the needle in place. Now, let's go to the infusion process. Following the manufacturer's instructions, turn on the infusion pump. Step 10. Complete infusion and record treatment. Put the removable section of the label for each syringe used in your logbook. Record the date and time and include the exact amount of Hizentra that you infused. Or scan each syringe into the app. Step 11. Clean up. Gently remove the tape or dressing and pull out the needle. Cover the infusion site with a protective dressing if needed. If you used an adapter, remove it from the infusion pump following the manufacturer's instructions. Place the empty syringes and any unused Hizentra and disposable supplies in the sharps container. Take your logbook along to your doctor visit and tell your doctor about any problems you have doing your infusions. Hizentra pump administration with prefilled syringes allows Melaine to live her life her way. Talk to your healthcare provider about whether it can help you too. You can learn more about Hizentra, including additional administration options, on our website, hizentra.com. You're encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/MedWatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958. Thank you from CSL Behring, maker of Hizentra. Please see full prescribing information, including boxed warning, at hizentra.com.